with Debbie. Today we are talking about do-it-yourself light therapies, and today we are talking specifically about skin conditions and applications in which you can use red light therapy to target certain conditions. Last week was the first session, and we talked about weight loss and skin toning, which is a very popular reason many people are looking at red light, but just like anything I like to talk about, there's never really one benefit happening. There's more than one benefit happening. So whether you are looking at red light therapies for weight loss or today's topic, which is skin condition, there's sometimes dual purpose and multiple benefits going on, even though the primary reason you might be using the device today is to treat a skin condition. So for those of you that are joining me for the first time, I invite you to tell me where you're coming from, why this might be of interest to you if you are using red light now. And if you do have some questions, medical or device specific, today is your chance to ask those questions to me. If you're watching this on a recorded basis after the live, feel free to tag me at Debbie with a Y, and I will do my best over the next day or the course of the next day or two to address any specific questions that you may have that you didn't get an opportunity to ask me today. So for those of you that are joining me, thank you. I always talk a little bit of science, and it's always different on camera. Today I'm going to talk a little bit about some of my recommendations for light therapy. And, there's never one perfect tool to treat everything. So sometimes, what's initially driving your research, maybe it's you're sore from working out at the gym, or maybe you want to, lose 5 more pounds, or maybe you're dealing with ulcers from diabetes. So there's lots of different reasons people are looking at this technology, and skin surface conditions is a very big topic. So, instead of it being all about labels, I have this or I have that, I'm going to go over some general conditions that many of you are likely dealing with, and just some of the logical aspects of why you would want to use red light for these things. And then I'm going to get into, like I did last week, there's a lot of choice. Lifepro has a huge lineup of red light products. Really, as I said, one tool is never perfect for every situation. So I'm going to allow you to ask me some questions about suitability, maybe things that you're looking at using it for, and offer you some suggestions with a couple of demos at the end. So if you do have questions for me, hello, Facebook user, correct. And we just need to get them all. If I had a much bigger house, I tell you. But yes, I'm starting to build bookshelves just to store things, because sometimes I deal with a lot of special needs. I deal with a lot of different countries, and sometimes a visual is easier than listening to me ramble and watch the precursor words on the bottom of the screen. So like I said, we've talked a lot about red light between myself, Amber, and Roseanne. There's a number of sessions, and if you're curious about doing a little research, there's never one perfect way to get information. Not everybody wants to listen to me ramble on a video. Some of you do. Some of you prefer blog articles. You can even go right into Lifepro's site and look at some of the benefits and just features that come with some of these different products if you are considering them. So do your research. There's a lot of information in-house. And, if there's something specific that you're looking for, like I say, tag me, and I'll be sure to answer your question, whether it's at the end of today's live or later on in the recording. So last week's session, I'm going to have that posted up for you. If you do want to watch, please try to keep today's questions to like skin surface conditions. If you have weight loss, skin toning, those types of things, larger body parts is how I would classify that. We'll drop a link in the comments today so you can find that first session from last Monday. But what is light therapy for skin? So I know what light therapy for skin is, but I'm always curious what Google thinks. So the first link that came up when I searched on Google today was a good source. It was via the Cleveland Clinic. And one of the things I want to caution when you're looking at red light therapy, blue light therapy, amber therapy, there's all different types of light colors. Light therapy is a very small spectrum within that bigger spectrum of the sun's light. We know that sunlight is good for plants. We also know that it's good for our body. There's a lot of biological benefits to exposing ourselves to the ray of the sun, but there's that one term, the UV. The UV rays are the harmful ones. These are the ones that we don't want overexposure to. And one of the things that you need to know right now with light therapies, the UV band is not present. So when you start asking me about how long and how often, and a lot of it is more driven by what you're trying to treat. Maybe it's a chronic thing, maybe it's a short-term thing, but I don't want to be too loosey-goosey, but it's kind of hard to overdo it with red light. Your body's only going to absorb as much as it needs. You don't need to do a lot of time to see a lot of relief, but depending on the device that you're using, I will get into some time suggestions when I get into the demo portion. In the 90s, and what does Cleveland say? So in the 90s, NASA really began studying the effects of LEDs, and there's a lot of overlap with vibration machines there as well, and the history that I have. LEDs effects are they were looking at promoting wound healing in astronauts by helping cells and tissues grow. Why is light therapy good? Because it rejuvenates the cells. It helps them become more efficient in performing their function. It's believed, and nobody's really pinpointed this, but the results are showing that red light boosts your mitochondria, which is, kind of the energy or the little powerhouse within your cells to perform more efficiently. So, if you are looking at today's sessions for wrinkles, if you're looking at healing lesions, whatever the purpose the cell is to perform, the red light is going to enhance the effects of the cell's function, rejuvenate the skin surface faster. If it's a pain thing, it's going to offer relief. So again, lots of different benefits going on here. They also go on further and say dermatologists and estheticians commonly use LED light therapy to treat a range of skin issues. Skin specialists often use LED light therapy together with other treatments. And how I'm always talking about combining treatments. So, if you're doing exercise, if you're on your dash bike, or you're doing a vibration machine workout, some of these therapies are wearables or hands-free, where you could set them beside you and expose yourself while you're doing other things. So, maximizing your time on your self-care routine. But let's talk a little bit about do-it-yourself home therapies. Once we get into products, I want to talk a little bit about conditions first. Things like eczema, hair loss, acne, psoriasis, rough, scaly, precancerous spots they've mentioned, rosacea, sun damage, wounds, wrinkles. As we age and expose ourselves to the elements or injury, scratch, there's all kinds of reasons the surface of our skin may develop blemishes or sores. And we know the healing benefits that the sunlight can offer us. And what light therapy offers is a compact, and the do-it-yourself versions are so affordable. If you've gone for treatments at a clinic or you've tried, some of the lasers where a lot of this primarily started, the LEDs are much, much more, I don't want to say effective, but efficient for a couple of different reasons. They have been found to be equally effective to the original laser devices that you may have seen in those medical settings, but they're affordable. If you're spending $400 or $500 a treatment and you got to go in 4 or 5 times a month, it's just not attainable. You got to put groceries in the fridge and pay bills. So a lot of the therapies that Lifepro brings to the table are not only attainable in the form that you can access them, but you can do them at home. And the real key with any of these therapies, whether it's for what we talked about last week or skin surface conditions like we're talking about today, is consistent, regular use. If you're dealing with pain, you're going to want that. If you're improving the skin surface, or you're trying to heal an open wound or something like that, the consistency of being able to treat yourself daily, multiple times daily for some of you is not only going to get you to the finish line quicker, but you can use it for other purposes as you explore and begin to experience the different benefits these give you personally. So a couple of bits of science I always choke you with. I don't completely make all of this up. I'm just kidding. But no, I'm always speaking from a place of science. And what I will caution is science is dabbling in this, but by far, there are many of you using red light. You have the anecdotal experience. You see these benefits happening, whether you have a study that you can link it to directly or not. Because good study just means there needs to be more use and more research. So the first one I brought to attention, and I always offer the links if those of you that like to dig into the study a little further want to take a closer look at the protocols and so forth. Red light phototherapy, which is another term you'll find it under in the medical world, using light emitting diodes inhibits melanoma proliferation and alters tumor microenvironments. So they're even looking at this with cancer therapy. I'm not here to diagnose, recommend any treatments, but if you've gone into some of the the progressive cancer treatment centers, a lot of them have embraced light therapy, certainly in combination with some of their other treatments. There's a calming effect. There's lots of different reasons that you may use red light therapy, but they're seeing some really good results with these types of advanced medical conditions. The conclusion in this study represented a potentially safe and effective melanoma therapeutic. Red light in particular prevented tumor growth and increased the expression of immune markers. They are associated with favorable melanoma outcomes. Further research is needed to determine the optimal clinical treatment. So again, I think sometimes when every study says, more research needs to be done, what it boils down to is it's like saying, what is the exact amount of time that I need to run on my treadmill to lose 5 pounds by next Tuesday? It's going to vary for everybody. So sometimes when you're reading these studies, you read all the way to the end looking for what is the magic setting and number and how long. And it's very vague for a reason. We're dealing with different bodies. And in a study, a lot of times there's control groups that they try to have similar characteristics, if you will. But when you're dealing with mass population, many of you have medical conditions, multiple medical conditions. Perhaps you're just athletic and you're using it for recovery. So what this means to me is that's a good news thing, because the only thing that they can say is we need to do more of this. So look at it that way, and what the perfect recipe is for your needs is where the experimentation comes in. So how often and how long, there are some pre-suggested guidelines in each of Lifepro's products, but you're going to have to experiment a little bit for your own needs and see what fits the bill best for your your body's different than mine, and it's going to respond differently to the treatment as well. The last one I'll mention, photodynamic therapy for basal cell carcinoma. I had a question about that one a couple weeks ago. There's different light therapies in color representation, and they're exploring a lot of them. So, don't get too hung up in blue or red or amber, because a lot of what's out there is guidelines. If all of the research was done, none of the, this would all be a medical device and it would be billed. And, it's a long way from being structured to that degree. But in the interim, you guys know the benefits. You've been exploring with these do-it-yourself therapies at home. And, much of the science is just validating many of the things that many of you already know. So this one, I'm going to have Jen drop the link so you guys can dig into that one a little bit further. Again, I make no recommendations, diagnosis, anything like that. Just information to share. I recommend you validate everything that comes out of my mouth, because that's how you learn and that's how I learn. But I personally have had, experience with a lot of customers, whether it's sunspots or surface level. And there seems to be, again, stressing consistency in using that treatment is going to be the best recipe for success. So there are different light colors, and primarily what you'll see being discussed out there in the market is going to be red light or blue light, but there's many shades of red. Haha, that was funny. But if you think of a rainbow, there's a lot of different colors within the rainbow, and we know if we take the sun's light and we split it, there's that whole rainbow of colors. And as more research and manufacturers explore and kind of fine tune these technologies, you'll see more and more options. And that's what they are, options. Maybe you've got sensitive skin, or maybe you're sensitive to light therapy because you're on drugs that are making you photosensitive. So there's also exploration into there's some that are maybe more suitable for your skin type and conditions that you're dealing with. So it's all good research, and a lot of the stuff that Lifepro comes out with, some of these features are coming out between pulse light and the different colors. If research is exploring it, we want you to have access to that now, so you can explore it on your own at home and experience the benefits sooner, if you will. So again, no black and white answer. It just gives you those tools to experiment in different realms and mix things up. Your body, just like exercise, gets used to anything after a period of time. So you should mix up what settings you're using, how often, how long. And then you'll find if you're using light therapy regularly, you probably will find as your body becomes attuned to the technology, you do not need to use it as often, or the result, because the results you're getting are lasting longer. So if it's a pain thing and you've kind of managed the initial, flare up, and you're finding the pain is staying away, don't stop doing it. Keep a frequency going, but you may not need to use it as often. And same with things like wrinkles or lesions. If you find you're aggressive in your patterns and you're using it more often when you're first starting, once you get to the maintenance phase, you likely will not need to use it as often or as long to get the same effects, because your body's receptive. It knows it's the good stuff, and it takes, basically as much as it needs. So last week I featured, I meant to feature 3, but I ended up featuring 4. Today I'm going to focus on 3. Not that there aren't lots of options out there, but because we're talking about skin care and some of the conditions that I mentioned earlier, I want to talk about 3 that I thought are not only on the lower end on the price point. These are very inexpensive technologies to get started with, but they're going to be ideal for a number of reasons based on my logic today. So the first one I'm going to talk about is the InfraGlow Glow Lab. Last week I talked about the BioHeal panel. These are very similar, and the reason I'm bringing up the panel is in my frenzy to get ready today, I do have a diabetic neighbor with a very sore leg. I'm going to leave it at that. So I have lent this to them, and I kind of got it propped up on a TV tray, shining on his legs. So this is out on loan right now, but these are very similar. This is a little bit more heavy duty. It's a little bit more of an investment. It has more diodes. What the lamp is it's a little bit more on the portable side. It's a more smaller. I'm going to bring it a little bit closer to the camera. Similar diodes. This is something you probably could take with you to the office a little bit easier. If you travel frequently and you kind of like your red light fix as a therapy, this is a little bit more of a portable option. And the reason I talk about this is how I ended up recommending 4 last week, because it really depends on where you personally plan to use it and what kind of body parts you're looking at treating. So if you're looking at treating something small area of your body, some of the stuff I'm going to get into is next. It's more specific use. This is good for more general use. So maybe it's muscle soreness, maybe it's weight loss. Today we're talking about skin treatments. So maybe you're dealing with a lot of psoriasis, or maybe you've got eczema on, a large portion of your body. What the bulbs are going to do, and these are hands-free treatments. So if you are dealing with pain and the skin is sensitive to touch, I absolutely recommend these, because you can set them beside you, have them cast light upon your skin surface without them being in direct contact where you might be sensitive for whatever reason. And as things heal, you might find that sensitivity is going to reduce as the inflammation reduces as well. So the InfraGlow is portable. It comes with a little carry pouch. It's got I'm just trying to think how many diodes. It's got the 660 nanomes, and it's also got the infrared. So there's 2 spectrums, just like the panel. These are, again, hands-free. They're going to be better for a larger surface area. And if you're using it regularly, this is a really good combination that you can combine with other things like your Dash X bike or your vibration machine, like I was mentioning earlier. Maybe you're doing exercises. You can set these beside you and have them cast upon those body areas while you're doing other things. Perhaps you're just sitting on the couch watching a movie. So that is my number 1 recommendation for treating skin surface treatments hands-free without you having to do it. And if you're a caregiver, a care provider, where you're administering treatments to other people and you're looking at incorporating some of these into your work, it frees you up. So perhaps you're doing a manual massage and you could be casting the light upon other body parts. So this is an easy way for you as therapists or massage therapists, home caregivers. If you're dealing with someone that has poor grip strength or poor mobility, you don't want them having to hang on to something or treat themselves. This is a really ideal tool to just set beside them, allow them to get that treatment without them having to physically, become part of the equation, nor yourself. The next one I'm going to move to is more of a targeted area tool. And I've got this one here. This is called, I launched this one a couple of weeks ago. If you go on site, it's called the BioCare, and it's launched as a cold sore device, but it's so much more universal than that. It is awesome for a cold sore. I'm going to show you what this looks like. So this is the case. In the case, if you are doing red light therapy, other than one exception, you need to protect your eyes. So the human eye can see the red light spectrums. Our four-legged friends are not affected. So if you're using your red light tools for your dog or your cat, you don't need to try and get sunglasses on them. Where did I put my little... Oh my goodness, I'm having a blonde moment. And now I can't see because I have my sunglasses on. Where did I put my tool? Oh, it's right here. Sorry, it rolled down. Okay, so I'll show this to you before I can't see. This looks very similar to the LumiCure, and it is an adapted version. There is an attachment on the top with a single diode, a very powerful single diode. This is why this would be ideal for treating, I'm going to put the glasses back on, if you do have a cold sore. Okay, so you could simply, this is a very specific targeted area tool. Maybe you've got a really bad pimple and you've got a date next weekend, and you don't want to do the whole face. Perhaps you've got inflammation in your teeth or a bad tooth. This is something that you could insert and just be a little more specific in where you're casting the light. When I did the launch on this product, tinnitus came up and earwax and all kinds of things, and it is very good if you look into red light for ear conditions. It's just a little bit of a better tool to target that area. If you want a little bit more, there's a little protective tip. I don't want to shine this on the brain. Okay, there's a little protective tip here. You can just take that off and clean it. Okay, so you could treat the air. Perhaps you're dealing with treating someone else, or you're caring for your pet, and it's just a small little area. It's just a really nice way to sort of target anywhere from, I'd say anywhere from a centimeter up to an inch and a half surface area. And what's nice about this as well is you can take it with you on the go. So if you're really trying to get consistent and do it regularly, perhaps you've got joint pain, or the tinnitus comes back regularly through the day, or if you're really trying to get rid of a cold sore, it's small enough and compact even in the case that you can pack it with you in your purse or your gym bag if that's something you want to experiment with. So I'm going to take the glasses off. And again, this one was launched as a cold sore tool, but I'm sure you have 50 ideas right now of what you might be able to use this for. It comes in the case, and I've got this assembled. You'll have to assemble it once you get it. It comes with 2 chargeable lithium batteries. I've got one. I always have them both charged, and you've probably got a good, oh my gosh, you'll have weeks of treatment because you're not doing it for 4 or 5 hours. But 3 short spot treatments, this is going to last you for a week or two. 3 to 5 hours, I think, on each of the batteries is my personal experience. There is a wrist strap. So if it's something you're taking with you to the gym, or you're going on a hike or something and you don't have baggage with you, you can strap it on that way. There's a lens cleaning cloth just to keep it nice. Okay. And then, of course, the manual, there's room for the manual. And make sure, if you're considering any of these, I always forget to do this, make sure you guys register for your lifetime warranty on any of these products. Every product that comes with LifePro, one of these cards is in there. Make sure that you're registering. And if you're new to LifePro, make sure you sign up to become a member of not only the main page, if that's where you're joining me today, but the VIP group, so you can be with the community that shares a little bit more on the experience, existing users. It's just a really supportive community, not only to ask questions, but, maybe do a little bit of research if you're considering some of these. You can talk with other members and just see some of the feeds there as to what their experiences are now. So the last one I want to show you is also a skin surface treatment, and it's going to cater more to the face. So this is what I would refer to is it's designed for specific use. What's nice about this mask, and it is the only exception to the rule with any of the light therapies that you can visually see, you don't see infrared, but any of the red or blue or amber light spectrums, the mask, it's a different type of diode, and you do not need to wear protective eyewear. So you can watch TV with this, you can work at your desk. This charges, I've already got it taken out of the box, so I didn't drop it. you can just plug in. You can see there's just a little, and you just charge this into your computer or your USB. And it's kind of like a pair of sunglasses. It's got little nose cushions here. I'm going to find the button. Okay. Okay. So this one you can see there's a clear path with the eyes. It's a completely different setup than the diodes on the other devices. Okay. So this one's going to be great for the skin. I have a lot of people that are looking at using red light for hair loss. This is another suggestion as well. You can just, like, you're putting your sunglasses up on your head. It's another way that you could use this. I'm 50. And to be honest, you know, instead of putting my lotion on like this and this, trying to fight gravity, you could also rest this around your neck and just sit back if that's a trouble spot for you. So anywhere kind of from the neck, the face, and then you don't have to, like I say, worry about these. Okay, the sunglasses. And this, you know, it's really easy to blow away 30 minutes with something like this because, you know, you're not required to wear the blue blockers. And I think out of everything that I have, this is probably the easiest, you know, to get started and set up. And it's probably the thing that I use the least. You know, I've got lots of lesions on my face, past acne. I had those issues. And when I stick with this and when, you know, at least just doing it once a day, I'm really good at using my other red light tools if I have pain or inflammation, because that's what I tend to go to first. But when it comes to the beauty piece, I need to be more consistent with this. So don't be like Debbie. If you're investing money in these tools, use them. This one you could also take to the office if you don't wear makeup, but I'd recommend if you're doing the face treatment, give your face a good wash, make sure it's clear of debris and things like that, so that the skin, give the skin time to recover. So when I am doing this, I prefer doing it at the end of my day, when I've taken my makeup off and my face can get chill, or if you're the type of person that, you know, maybe does some reading or something like that in bed before you go to sleep, this is a good little tool that you consider. Now this one has a couple of different lights. So this also has the blue and the amber spectrum. There is, if you look at the product on site, there is a little bit of a breakdown as to what the different, everybody's going to say, well, what's best for what? If you're just joining me, I said earlier in the session, you know, research still really hasn't defined definitively exactly, and they never will, because there's just too many variables out there. I suggest you experiment, but some of the guidelines that Lifepro recommends, and I concur with this, blue tends to penetrate the pores. I'd recommend it more for, you know, for the kids with the acne. You know, think blue, think cool. I have read some studies that have said it, you know, it leads better towards reducing inflammation, cooling the skin surface, but it definitely does interact with the pores. Red is better at reducing the lines, lesions, and wrinkles. A lot of the open wound healing, the diabetic sores, you know, even just a scrape from falling off your bike or your rollerblades. Red light is very, very well studied for accelerating wound healing. So that's where the red light comes in. And then amber is believed to soften irritated or inflamed skin. So you're going to have to sort of play with what feels comfortable to you. And again, having the three different lights is, you know, you could do 5 minutes on this portion, 5 minutes, you know, mix it up. Just like exercise, your body gets used to anything if you keep it the same. And as I said earlier in the system, or in the session, you'll find with red light, once you start using your therapies regularly, and your body adapts to the technology, you're probably not going to need to use the treatment as often or for as long, especially with chronic conditions. So as you notice the pain and the inflammation improving, you'll also notice that it's going to start staying away a little bit longer. For today with skin surface conditions, if you're dealing, you know, with beauty and aesthetic reasons, there's a lot of different options here. But again, keep in mind what area of your body you're treating. So watch last week's session. I did talk more about larger body surface areas. So if you're dealing with a large patch of eczema, you know, a large, you know, maybe you've got a scrape all the way down your leg from falling off that bike. You know, the InfraGlow, the panel, some of those where they're hands free can target a larger area better. The BioCare device that I talked about today and the LumaCure are a little bit better. Wait a minute, I'm trying to make my display look all fancy. And the VisiCure are a little bit more specific use. This is obviously ideal for the face, neck, and head. This is better for smaller areas that you're trying, maybe there's a little sunspot that, is giving you some trouble and you just want to target it specifically. It's a little bit more versatile on the go. It's lightweight. And as I said, it's marketed as a cold sore tool, but I can't stop thinking about things that you can use it for. So it is very similar to the Lumicures, but it's got a little bit of a different setup and the protective tip. It comes with a case, and the lithium batteries should last you 3 to 5 hours a piece. Okay, no more science. I'm going to move a little bit closer because my old eyes need to see if there's who's joining me today. And Erin is asking me, do you wear your glasses under that? If you're referring to the mask, no, you do not need to wear glasses underneath this. It's kind of been designed with different diodes, and the area of the eyes are not they're not blocked. But no, this is the only Red Lifepro product that you do not need to wear protective eyewear with. Any of the other ones, if it's going to be exposed to your eye area, use precaution and wear the glasses. So who else have I got here with me today? As I said, this is the second, just so you know, the second of 3 sessions. Last week was about weight loss and skin toning. Today's questions are specific to skin surface conditions. And next week, I'm talking the main stuff, the chronic, the pain, the swelling, the inflammation. We're going to talk about more pain management is going to be next week's session on Monday as well. Okay, so let me see who I've got here. Hello, Dolores. How are you? Happy Monday. Hey, Deb from West Texas. What's a good natural substance to use after red light therapy? Depends what the goals are. I mean, the common sense stuff, this is a light therapy, it boosts circulation and lymph for those of you that are dealing with conditions. You want to make sure you're hydrated and adequately rested. If you're talking about skin surface lotions, if you do have to, if you have a tendency to be using these for like dry skin or conditions, you probably have some topicals you've been recommended to use. You're absolutely fine using them in combination, but if you're using a topical or you're taking any medications that make you photosensitive, you should just clear it with your dermatologist or your care provider first. Doesn't mean you can't use it, but you may need to maybe reduce time or use a different type of tool just because you're a little bit more sensitive. There's always a way to kind of mitigate it, and you may just need to change how you apply the tool until you're over the medication or something like that. And thank you, Jen, for posting those links to back up my ramblings. How do I use my BioHeal on my face, and how long will the glasses that come with it be enough protection? Yes, they will. Some of my clients are using sunglasses as well. To be honest, when I'm treating my face, I have old sunglass goggles because I want, I don't know, it's just what I got used to in the tanning bed. But I'm usually laying down. And last week I was laying down in the Rejuva Wrap sauna, and I had the little goggles on, and I was using the InfraGlow lamp just because I clipped it on the edge of the window. So another way that you can combine these things. But if you're casting the red light in your eyes, I'd prefer that you have something to protect the eyes if you don't have protective eyewear. Usually with the devices there, depending on which one you get, some of them have the eyewear included. But if you mail in your warranty card, and of course I've zipped it up and been all efficient already. Just a minute. Thank you for bringing that up, Dolores. Yes. Register that. And if you do not have a pair of sunglasses that you can use, I believe that they sell these online. My husband doesn't mind wearing these, and my son, but I prefer, like I say, I've got my own little sun tanning glasses. I'm usually laying down when I'm doing those treatments. If I'm not laying down, I'm looking at my computer and I find other things to do. But most of the larger, more substantial, like the panels will come with these. And then with something like this, I don't want to break the rules, but it kind of depends. I mean, if you're treating somewhere like this, or you're doing your foot, just don't look at the light. You know what I mean? This isn't casting as much red light as one of the panels or the lamp. So just use precaution if you're using it in the eye area. And usually a pair of sunglasses is just as sufficient. Thank you again, Jen, for posting my study rambles. Does it help with fibrosis? I have seen some of my clients have success with fibrosis. It depends on how deep. And sometimes if looking at a product that combines the light therapy with the infrared is something you might want to do a little bit more research on. But it kind of depends on where you're treating and how big of a surface area again. But yes, there has been some research supporting that. What I'm speaking from is more experience with my clients that have those types of symptoms. Consistency is going to be the key with something like that. So if it's painful fibrosis, you might find yourself using it 2-3 times a day to manage the pain. Longer term, you may not need it as often, but I would say at least daily to kickstart something like that. If I were to give you my 2 cents. For how long is going to be more best recommended by the type of device that you're using. There's high intensity products and there's low intensity products. Low intensity products are going to be things that sometimes you're exposing yourself to longer, especially the weight loss treatments. You're not going to just cast your face mask on you for 5 minutes and get the results you're looking for. Some of the LumaCure, the torches, they are designed to be a much faster, very specific area treatment. So some of those treatments are going to be more like 3 to 5 minutes. They have a higher intensity and they heat up a lot quicker. You do not need to use them as long. And then your skin condition comes into it. Like maybe if you're very sensitive, you might need to do more frequent treatments for short periods of time and then build up from there. It really depends. So I would always suggest being conservative. I don't like using the word starting slow, but try 5 minutes, give it an hour, see how you feel. If you're prone, if you're very fair skinned or you're sensitive to sunlight, just something to consider and try a short test patch perhaps first before you commit to a long treatment. I can think of several uses for the BioCare. I know, right, Patricia? Sorry. I'm thinking, like, honest to God, like hemorrhoids. That was another one I was thinking about. I can't do that one on camera, but I deal with a lot of very severe medical symptoms. And sometimes when you're a caregiver, especially, or if you're dealing with someone that's elderly, something that's always in my brain is grip strength. So the hands-free technologies or the little tiny ones, sometimes it's not that they're necessarily the best tool for everybody, but for that frail little hand that has grip strength issues, some of these more petite tools make it easier to promote self-care and take care of yourself that way. Gold Finding says good vibes from South Texas. Hello. Patricia says, I love all the info you share. Sometimes I ramble and, sometimes it just comes to my brain while I'm doing it. What else here? Thank you for posting my top 3 again. If I went over everything with the way I talk, we'd be here for 2 days. But, sometimes what I think is a good idea wasn't something that you thought of. And the reason I encourage you reciprocate and talk back with me is, a lot of the ideas I come up with sometimes is just your experimentation with guys like you. So maybe you've come up with another way to use it. The sky is the limit. You're only limited by your imagination and your range of motion. I always say that. And I think that is all I have for questions today. If you are here and you have a question for me, I'll give you a couple more minutes here to get that posted up. Next week, we are talking about the chronic stuff, the pain. If you want to be notified about these lives, a lot of times after the fact, I get, I didn't know about it or I didn't see the notification. I'm always here on Mondays. I may change the time from time to time, just depending on what, seasonally your life looks like. But I'm always here on Mondays with the Q&As. And if you see the notifications or you see the posts in the pages, make sure that you just interact, say that you're going or you're interested. And then what'll happen is you'll get notifications going forth. I forgot the live's in an hour. So you'll get reminders. And even I mark myself as going so that if I'm, distracted and I'm working on other things, I get my little Facebook reminder that you're live at 3:30 Mountain Standard Time today. So this week I was live at 5:30. I will confirm, we'll keep you posted for what Monday's live is going to be, but I will be here Monday for Thanksgiving. And if you have questions and you're watching this on the recorded basis, please just tag me at Debby. I'd be happy to answer any questions. If I don't have the answers, I'll certainly look into it a little bit further and try and fill in the blanks for you as best as I can. So I hope you enjoyed today. Whether it's rosacea, whether you're dealing with diabetic ulcers, whether you're just trying to get rid of some fine lines, you entertain this non-invasive technology. You've got nothing to lose but the spots and the wrinkles. And I thank you for joining me today. Don't work too hard, guys. Have a great rest of your week. And I look forward to seeing you same time next week on Thanksgiving Monday. Have a great rest of your week. Oh, wait, I have 2 more questions. Tease, I'm just a big tease. Erin is asking me, have you heard of these being used for clogged salivary glands? It's a very good question. You know what? I'm gonna be cocky and say I bet you yes. I have for sure seen something on tear ducts. So I would think that there would probably be a common correlation, but any kind of blockage, scar tissue, whatever, it depends what's causing that blockage. But I would be very curious, and this would probably be a good tool to target something like that. And then Christine says, can you charge the VisiCure from an electric car outlet instead of a computer? Well, it's got a USB and on the darn thing. So if you've got a USB charger in your car, I know I've done other red light therapies in the car. Give it a shot. I'm pretty sure that you could just put that into your USB port in your car, or if you've got one pre-built, I don't think it would be an issue at all just to charge it on the go. The face mask lasts a fairly long time. I usually do a 30-minute treatment, and I usually get at least 4 or 5 sessions out of it. But if you've left it short, yeah, it's a 2.0 USB connector on mine. I've had mine for a few months, so it might be the newer 2.0, but it's usually going to be a universal fit, probably with other adapters that you have as well. I hope that helped. Debbie, can you charge? Yes, so I've already answered that. Thank you for the last 2 questions. I'm glad I caught you guys. And any others, like I say, just tag me at Debbie, and I'll be sure to address those throughout the course of this week. Don't work too hard, guys. Talk to you next.